Pregnant individuals often hear that fish is one of the healthiest foods they can eat, yet there is a hidden danger lurking in certain tropical waters that must be understood: Ciguatera poisoning. Unlike mercury, which accumulates over time, or bacterial spoilage that can often be avoided with refrigeration, Ciguatera comes from a naturally occurring, heat-stable toxin produced by microscopic algae in reef ecosystems. When herbivorous reef fish eat these algae, the toxin accumulates and magnifies as it moves up the food chain. Large predatory reef fish such as barracuda, grouper, snapper, and amberjack are particularly dangerous because they concentrate the toxin over years. Unlike many foodborne illnesses, cooking, freezing, or marinating does not destroy Ciguatera toxin. Consuming contaminated fish can trigger severe gastrointestinal distress, nausea, vomiting, diarrhea, as well as neurological symptoms including tingling, temperature reversal sensations, muscle aches, and intense fatigue. Symptoms can persist for weeks, months, or even longer in some cases. There is no known antidote, and treatment focuses on symptom management and hydration. Because the toxin is invisible and cannot be detected by smell or taste, avoidance is the only safe strategy, particularly for pregnant individuals whose neurological systems must be protected for fetal development. Travel advisories and local seafood recommendations in tropical regions are critical resources for identifying high-risk species and avoiding potentially toxic fish. Pregnant travelers in the Caribbean, Pacific Islands, and certain Indo-Pacific regions should be particularly cautious and avoid eating large reef predators altogether. Despite this serious risk, fish remains an exceptional source of nutrients that are uniquely beneficial during pregnancy. DHA, the long-chain omega-3 fatty acid concentrated in fatty fish like sardines, anchovies, wild salmon, and trout, is an essential building block for fetal brain and retinal development. Research shows that maternal DHA intake is strongly correlated with improved cognitive outcomes, visual acuity, and neural development in infants. Regular moderate consumption of low-risk, small oily fish allows pregnant individuals to benefit from these powerful nutrients without exposing themselves to Ciguatera. These fish are typically low on the food chain, smaller, and fast-growing, meaning they accumulate minimal environmental toxins while providing a dense source of DHA, protein, iodine, selenium, and vitamin D, all nutrients that support fetal growth and maternal health. The positive impact of DHA on pregnancy extends beyond neural development. DHA contributes to better pregnancy outcomes by supporting proper anti-inflammatory balance, cardiovascular health, and retinal formation in the fetus. It also plays a role in regulating maternal mood and reducing postpartum depression risk, possibly through modulation of inflammatory pathways and neurotransmitter function. For infants, adequate prenatal DHA correlates with higher early life IQ scores, better problem-solving skills, and enhanced visual and sensory processing. Even modest servings of safe fish twice per week are sufficient to provide these benefits while minimizing exposure to environmental hazards. To maximize benefits and minimize risk, pregnant individuals should focus on sourcing fish carefully and consulting reliable guidelines. Low mercury, small fatty fish such as sardines, anchovies, wild-caught salmon, and trout are consistently recommended. Large, long-lived predatory fish should be avoided entirely, especially in tropical reef areas where Ciguatera is prevalent. When traveling to high-risk regions, local advisories or government resources can identify which species to avoid and provide practical guidance on safe seafood consumption. Maintaining a balance between nutrient-rich fish intake and toxin avoidance allows expectant mothers to safely nourish their developing babies, harnessing the unique power of DHA for brain and eye development while respecting the invisible but serious hazards present in some marine environments. By understanding both the potent benefits and hidden dangers of fish consumption during pregnancy, parents-to-be can make informed dietary decisions. With careful selection, avoidance of high-risk reef predators, attention to regional advisories, and moderation, fish becomes a powerful tool for fetal neurodevelopment and maternal health rather than a potential source of harm. The combination of DHA, high-quality protein, essential minerals, and vitamins supports optimal growth and sets the foundation for lifelong cognitive and visual function in children, proving that with knowledge and vigilance, the ocean's most valuable nutrients can be accessed safely even in a pregnancy context.